Favors Show on SiriusXM Urban View.
Welcome back. You are listening to Lurie Daniel Favors on SiriusXM's Urban View, where talk empowers and becomes action. Y'all know I be scouting for organizations who help us figure out solutions to the problems that we're having. And this is important because while it's easy to figure out, how we point to and identify the problems, we're also interested in solutions. And we should be, because frankly, there are people out there who are doing the work of resolving some of these issues, and their stories need to be highlighted. It's one of the reasons I'm so excited about the conversation we are about to have with my next two guests. First up, and I'm going to apologize in advance for butchering any names. I'm going to give it my best shot. I've got it phonetically spelled in front of me. Anthony Buissereth, is that correct? He's like, okay, 8 out of 10 maybe. All right, close enough. Thank you. We're going to correct it on the other side. But he is a veteran of New York City's nonprofit sector with more than 16 years of experience in nonprofit management, fundraising, program development, advocacy, and government and community relations. And he came to KAVI, the organization we're going to be talking about today, after 4 years of serving as the executive director of the North Brooklyn Neighbors, which is an environmental, ding, 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 ding. Y'all see the connections here. We've been talking about trees and Black communities. You see what I'm doing here. And community planning organization based in Williamsburg. And Ramik Williams also joins KAVI as an expert advocate and champion in K through 16 education. And I love that, K through 16. No more K through 12. We're beyond high school at this point. And workforce and youth development. Ramik has dedicated his career to eliminating racial disparities in economic, education, and health systems for communities of color. And I am so excited because both of these gentlemen are a part of the KAVI, K-A-V-I community. And I'm just grateful for them to be here because, boy, is this going to be a timely conversation. Welcome to the conversation. Welcome to the Lurie Daniel Favors Show, gentlemen. It's a pleasure to have you here.
Thank you for having us.
Thank you. Now, first, let's start out by talking about the organization KAVI, which stands for Kings Against Violence Initiative. Anthony, I'm going to start with you because this will also give us a chance to hear how your name is supposed to be pronounced. But I want to start with you. If you could give us some background as to how KAVI got started and what issues it is designed to address.
Thank you for having us. It's Buissereth. Yeah. So KAVI was founded in 2009 by a doctor in the who was working in the emergency room at Kings County Hospital, Dr. Rob Gore. He saw an uptick in specifically young Black males coming into the hospital with violent injuries, and thought that we can go upstream and try to resolve those issues. But poor folks have to come in with an injury. So KAVI has a hospital-based program based in Kings County where we see everyone who comes in with a violent related injury. And we've been doing that for 14 years-ish. And we also have a schools program where we work in nearby schools to work upstream to help prevent violence. That's the kind of the roots of the organization. We've definitely expanded beyond that. The organization's original work was primarily centered in Central Brooklyn because Kings County is the only level 1 trauma center in Brooklyn. So it sees over 1,200 traumas a year. So that's where we've had our largest impact, but we're definitely expanding that work.
And I will just say, full disclosure, we love Rob Gore on these airwaves. He, his beautiful wife, their family, we absolutely love them and the work that they do. And I've had a chance to interact with them in real life. So, it's often not the case because a lot of our conversations are with folks from all across the country. It just so happens Brooklyn is the center of my universe still. So, there's that. But the fact that we had somebody who was at the behest or at the helm of this organization who was seeing the impact of gun violence literally at the tail end, right? When folks are coming in, hopefully able to be saved, many times not. And sometimes when there's that phrase that says those who are closest to the problem should be closest to the solution. It's really important that we recognize that being a Black professional does not excommunicate you from dealing with these issues. And sometimes, depending on how you navigate your profession, you're actually given a bird's eye view as to what's happening and are then able to be motivated to do something about it. And I think that's exactly what we see happening in this case, in the case of Kings Against Violence Initiative. Ramik, one of the reasons that I was so excited about you all is because of some of the growth that you have experienced. I believe you all are also one of the winners of the Spark Prize Award for the Brooklyn Community Foundation. Is that correct? Yes. Okay. So, Alex, that's a round of applause worthy. Can we give the brothers a round of applause for that? Because that is a huge accomplishment. And I know it's a huge accomplishment because my organization won that prize many years ago at the Center for Law and Social Justice. So I'm crystal clear as to the amount of work that goes into that. But you all have really brought this initial program into a space where right now, as your counterpart said, you're doing so much more beyond that. Talk with us about how the program today is continuing to build on that history and the way in which your school-based programs are actually able to help be preventative as opposed to just coming in at the tail end, which may have been more of what was happening at the beginning.
Yeah, so in addition to what we do in the hospital, we work in the schools and we work in community settings. That's our direct service work, but we also do advocacy and research. And that is really the three-legged approach and the foundation that we stand on, recognizing that it takes policy change to enact some of the ills that we see and the manifestation of ills that we see every day in all of our programs. And so our schools-based work is both, I would say, preventative, but also reactive. So we're working with young people that have been identified as maybe participating in dangerous, unhealthy behaviors. It could be violence, it could be drug use, it could be unhealthy sexual behaviors, it could be all of those things. And so we work with them in addition to working with those young people who have yet to participate in those types of activities, but are vulnerable to them for whatever reasons, right? During the pandemic, we saw an increase in sense of isolation amongst young people. We saw an increase in the sense of hopelessness amongst young people. We saw an increase in suicide ideation and suicide attempts amongst young people. And so our programs seek to build community amongst those young people so that they take agency over their lives, right? They feel a sense of hope and the ability to thrive in an environment that really isn't set up for them to thrive, right? So some of the legislative work that we're looking at and what we call protecting the adolescence of Black and Brown youth really is designed to give them the opportunity to seek new opportunities, whether they be education, workforce development, career, economic, and an environment where laws aren't working against them. So the Clean Slate Act is a legislative agenda item that we're looking at. We're looking at Senate Bill S580, which helps support hospital and community-based violence interruption programs. We're looking at enhancing school safety legislation that allows young people to go through the school disciplinary code when they get in trouble in school, as opposed to going through the criminal justice system, right? And so there are differences. There's research on this that shows that young Black and Brown people are more likely to go through the criminal justice system than they are go through the school discipline code, more so than their white counterparts. And so if we're able to alleviate some of those challenges and those barriers, we feel and we feel strongly about their ability to thrive, right, and really show the work they are. And so it's up to us adults to remove those barriers. The other part to our school-based program is working with schools as partners, right? Recognizing that schools are institutions within communities, right? You have generations of individuals who go to the same school, right? Brothers, in some case, parents went to the same community schools. And so if we're able to be partners and fill the gaps where holes aren't able to, like, for example, supporting them with mentorship opportunities, mentors. So some of our hospital violence staff serve as also mentors in local high schools, providing those types of resources and support that young people need. And they may not be able to form those connections with their teachers, right? They may not be able to form those relationships within the traditional school setting. So expanding that. The other part is to expanding the accessibility to the school building. So our programs run after school, right? And so giving a safe space to young people beyond those hours. There's several data points that support the need for that. One is the data that shows young people between the ages of 15 through 17 are more likely to get in trouble after 5 o'clock. And so if we're able to expand our ability to provide programming to those young people, they'll have a place where they'll be welcome for sure, but also a place where they'll be productive.
So I feel like each of these legislative components really could deserve their entire own conversation. So I'm thankful that you were able to run down through those, because now I have a whole bunch of other questions that we may have to schedule a part two. But I want to come first to I'm just saying, you got some brothers who talk about the legislation. We often are trying to say, how do we take a problem and then have a legislative solution? And you just had a whole bunch of them. And if I recall, were you you might have been the person who was presenting for your acceptance at the Spark Prize breakfast, because I think you got through like 6 legislative points and you was like, I got like 13 other ones, but for the sake of time, I'm gonna have to wrap it all up. It was very impressive. It made an impact. But I want to perhaps, Anthony, if you could talk us through what happens if I am a young Black child, or, whatever your population is, and I am presenting at the hospital. I have been victimized by gun violence in some way. What does the KAVI program do? How am I met at the hospital with my trauma care doctors in the emergency room? How does KAVI then come in and hold my hand and basically help me navigate what's going to happen to my life next?
So as patients come into the hospital presenting with assaults, stab wounds, gunshots, first they have to be stabilized. And once they're stabilized, there's a time called the golden hour. So folks who've been involved in various activities that may have led up to their injury, it's a time where they may consider something different. And that's when KAVI folks can meet them. We meet them in the emergency room once they're stabilized, to talk to them about what happened to them. We have a trauma-informed care approach. So we're not there to tell them they did something wrong. We're there just to hear from them about what got them into the situation, and then have them think about how they want to move forward. So depending on how long the patient is in the hospital, we have multiple interactions with them. Like if they're going to be in the hospital for a stay, we meet them with a care package. We actually get their consent to participate in our services. And then, we have all sorts of resources. So in the care packages, there are things like journals, but there's also things like puzzle books and phone chargers. We think about as patients come in, they're coming in, at a very vulnerable moment. And they just need they need a friend, really, and somebody to talk to. And we're there kind of break down that wall, and I help them identify their next steps. One major component of our work is providing mental health support services for patients. It's a thread that runs through all of our programs. So eventually, if a patient is with us for a while, we see them through, and we're actually integrated into the discharge process at the hospital. And then we engage in a service package that includes mental health supports. But then eventually we have these group setting therapy sessions for patients called SELF, where it's a 10-week kind of journey where safety, emotion, loss, and future, where they walk through a process with peers who've also been impacted by a violent injury, to think about what their future will be. And then we connect them to all other services that they need. But it starts in the emergency room.
This is what's heartbreaking about this is that it feels like this is something that all Black children should have, right? When you talked about the care package and you mentioned the cell phone charger, and that gave me a little bit of pause, because that's really thoughtful, because typically if you're in the hospital, one of the biggest issues is being able to communicate with people and letting them know what's happened. And, the last time I had to go to the hospital, I was like, get my cell phone charger, because I did not want, it was during COVID. And I remember hearing about people saying the only way they could communicate with people was, if the phone died. And so there's a lot of thought, it feels like, put into what is contained in the care package. And it just seems to me a bit tragic that some of our Black children are only getting access to this sort of care after this sort of trauma, because it feels to me like this is the type of care that they should have wrapped around them beforehand, and that all of our children should have. And the idea that there's a group therapy component built into it, walk us through why that component is so necessary, particularly that component not in sort of a one-to-one therapeutic space, which I also think has a very important role. What are the additional benefits that come from being in a therapeutic space after being victimized by gun violence with other peers that are going through the same thing?
You want me to take it, or you want Ramik to jump in?
Either one. Ramik, you want to take that one? Either one.
Sure. And I'll start from meeting them in the hospital as individuals, right? And so we meet them in meet them in a part of the trauma-informed care helps us give them agency over their lives by asking them not necessarily what happened to them, but how did they get here, right? How did they get this space, so that we identify the issue of recidivism. So if we can identify how they became a hospital patient, we can identify what decisions led up to that, right? And sometimes it's accidental, sometimes it's through no fault of their own, and other times it's decision-making in terms of friends and environment, decision-making in terms of getting involved in other violent, dangerous behaviors. And so the group setting allows individuals to recognize that they're not alone, right? That they have made decisions or something has happened in their lives, but it's not just them. And so they're able to form these fellowships with other individuals where they can lean on them and hear from them what their experience has been, whether it be where they're at in terms of healing, both physically and emotionally, where they're at in terms of new goal setting, what it takes to get there, to build resiliency along their new path, and also just changing their environment, right? Now that this tragic thing has happened to them, gunshot wounds, assault, stabbing, all of the above, now it's about what's next for them. And so having some sort of community circle, some sort of folks to lean on is really important. If we're honest with ourselves, right? No one gets to this space by themselves. We all have had someone that we can turn to, someone that we can hear from, that listens to us, and all of those things. And so we provide that new opportunity, that new beginning through our group activities. But it's also supported, as you were saying earlier, by individual counseling as well. So we have social workers, we have social work interns. We work deeply with Kings County Hospital and their social work department to provide those individuals with social work services on an individual basis.
You mentioned a difference between two questions that stuck with me. You said it's not that the question is, how did you get here, not what happened to you. What's the difference between those two questions, Ramik?
It allows you to take agency over your lives, right? By identifying how you got here, right? By saying, yes, you were born, you may have been born into a unique set of circumstances. Yes, you may have, experienced something unique, something violent, something tragic, something almost deadly, but that is not who you are, right? That is not what defines you. And so now that you've experienced that, now that you've gone through that, what can you do? What do you want to do to change that, right? So that you don't end up here again or worse, right? And so it's very semantic, but when it comes into practice, when you have social workers engaging with people, when you have case managers engaging with people, youth developers engaging with people, co-executive directors engaging with people, that really allows them to say, hey, anything is possible. I don't want to end up here again. What am I going to do? And these folks are going to help me get there, right? It's about building a partnership that allows individuals to lean on us and see us as an ally, especially with young people, right? Where there's really a lack of visible role models, right? In terms of connectedness, right? Especially when we talk about young people who are on the track to either being victims of violence or being perpetrators of violence, and looking at the rates of isolation, how they feel, it's no mystery, right? And so we're in that space, and we're allowed to, we have the opportunity rather to form these really positive relationships with young people, and that's our approach to doing it.
I like that. And I had a feeling there was something to that. Sometimes there's a distinction without a difference, but sometimes those slight distinctions make all the difference in the world. Andrew, I have to, or excuse me, not Andrew, Anthony, I think I was combining your first name with the last name. So we're going to have to start all over, Anthony. But when it comes to nonprofit administration, so I'm taking off my radio show hat. I'm putting on my nonprofit executive director hat right now. One of the things that I know my funders for the Center for Law and Social Justice at Medgar Evers College are always concerned about are outcomes. Yes, Lurie, we know you can paint a beautiful picture. We know that your law center does a lot of good work, but what are the outcomes? What are the actual results that you're able to prove or establish? And for a lot of Black-led organizations, we can stumble sometimes when it comes to our outcomes, and we can stumble when it comes to measuring our impact. That's one of the things that I focus on a lot when it comes to bringing on nonprofit organizations. So Anthony, talk with us. What are the outcomes of all of this work? And my follow-up question is going to be, how are you able to sustain sustain this? Is this all a volunteer basis? And I'm asking not just because I'm trying to be in your business, I'm asking because this is a national show. And
Yeah.
you are talking about programs that and problems that have a national resonance and that people all across the country are grappling with. So I want people, as much as I'm going to now put out a call for them to go to your website and to support you, I also want people to try to replicate what it is that you're doing. What are some of the outcomes that you're seeing as a result? Because this sounds like it's the legislative branch, the school, up the pipeline, down the pipeline, hospital. But what are you able to produce and stand on in terms of your bragging points as a result of all this work for a population that a whole lot of people in this country would much rather just throw away?
So, I mean, when Ramik and I joined, we joined the organization that had a strong programmatic foundation. So in the hospital, fewer than 2% of the folks who go through our services come back with a violent injury within 2 years.
Wait,
And
what? Say that again? What?
Yeah, it's fewer than 2% of folks who come back within 2 years with a violent injury. And typically with this population, it's closer to 40%. So that's how we know that we're having a significant impact, because we help folks, guide them along a path that helps them build a new future for themselves. But since we joined last February, we definitely built out kind of the data and evaluation part of our work and deepening research. We have research project with some national evaluators to kind of build out and sort of tell the story about the effectiveness of our work and where we can strengthen some of our programmatic parts. So I would say that. Additionally, I'll say Ramik and I were employees 7 and 8, and when we came, and we're now at 31. So it's really about scaling to meet the needs, but also connecting it to the right programmatic part. So we've definitely had an influx of funding, and we're happy to have more of it if folks go to our website. But we've scaled smartly along specific program areas, which include, like, we're going to be expanding work into some nitrous developments to do more on the ground community work in nitrous developments. We've expanded our work in some of our school partnerships. We're definitely growing out our work in community facing spaces. So yeah, I think that answers your question.
So if I were interested
Ramik has more to add.
Go ahead, Ramik.
I would love to add just to the question of what are our results. So one of the things that we're looking at in this space are, how do we form metrics, right? Beyond recidivism, there are certain things that lead up to recidivism. So change behaviors, forming new relationships, right? Forming new friendships, returning to school, returning to home, pursuing employment opportunities, setting goals. So those are the types of things that those incremental steps lead to larger change. And I'd say just overall working in this crisis management system, cure violence system, as a youth development organization, some of our research projects with Karna, with the Urban Institute, are designed to actually give definition to those outcomes, right? Really try our efforts to outcomes so that we know what we're doing, right? What is a high touch, low touch model for our program? How many interventions do we need to have with people between the ages of 14 to 17 or 17 to 19 or 20 to 24, right? So that we can not only replicate what we're doing, but enhance what we're doing. And so one of our programs that's new or launched early this year is our statewide initiative to find a sweet spot between practice and research, right? Practice and capacity building and technical assistance. And so our colleague Mariama is leading that initiative. Actually, it launches tomorrow. And so that's part of the other work that we're doing. And to your point of what shows that we're having an impact, it's those types of things.
This is fantastic. And I love that you said how to form metrics, because one of the things that we can often slip into in terms of traps for nonprofit organizations, community-based organizations, particularly those that are Black-led, is trying to produce metrics that ain't really got nothing to do with what we're doing, right? But having other people define what we should be doing for us. Now, we know what we need to be doing. We know what the impact that we are having, but measuring it is an area that we need to strengthen, and knowing what metrics actually matter, because yes, recidivism is important, important, but change behaviors. Are you now, as a result of this program, able to make different decisions? Do you have a different decision-making framework? Are you returning to school, returning to work, the setting goals? See, I take notes. I believe in notes. So like these are metrics that we need to recognize are important for us. And then we can teach and train funders that, no, I know what you care about, but this is the metric that is actually going to determine how successful this program actually is. So we're not just interested in mere attendance at programs. We're thinking about how is the attendance in that program also leading our young people to change behavior so that they are living healthier, safer, and more thoroughly fulfilled lives. So if I wanted to go to donate to KAVI, I would want to first make sure that you are a 501c3 organization. I can sort of skip past that because I know that you would not be a part of the Spark Prize family for the Brooklyn Community Foundation if you were not. So that question, Lurie, can already answer for y'all audience. You ain't got to worry about it. But if you were interested in donating, you would be able to go to KAVI Brooklyn, KAVI Brooklyn.org, because Brooklyn, it's because it's Brooklyn. But, now that I'm in New Jersey, I have to be equal opportunity in terms of my neighborhood affiliations. But you could go to KAVIBrooklyn.org and you would be able to donate. Are you accepting volunteers as well, or is your need primarily monetary at this point?
I would say go ahead, Ramik.
We are accepting volunteers. Definitely, we're finding space for them, recognizing that not everyone is able to do case management or social work, right? It may be you have marketing skills, you may have grant writing skills, you may have legal skills. So we're finding that space. But we do work in an environment where there are finite fiscal resources, so donations are very much welcome.
Ashe and amen. Listen, I've become much better at fundraising since I transitioned to executive director than I ever was before. So I'm crystal clear that the work costs money. I would love to have a volunteer-based revolution, but somebody got to get paid some kind of way. So it is what it is. I'm really grateful to the work that you all are doing. I know that the vision that Dr. Gore had when he first set out is something that was magnificent in its effort and its intentionality, and it feels magnificent in the way that you all are working it out. At some point, we're going to have you come back because I want to hear more about the Clean Slate Act and the school safety and navigating disciplinary school-based programs as opposed to criminal justice-based programs. So please be on the lookout from Shayla. She will be reaching out to see if we can have you back on to talk about that. Those are two pieces of legislation and the expanded school building access. Those are three programs that I think are really able to be replicated in other spaces, and they can that can happen legislatively and as well as on a community-based level. Any final words or comments from either of you about how we can connect with you? Anthony, what is your social other than the website, KAVIBrooklyn.org? Are y'all on the socials? How can people continue to connect? Yes, you can find us on
Instagram, on Twitter, KAVI Brooklyn. We're also on LinkedIn. We're also on YouTube. We're out there.
We out here. Stay out here. It's been a real pleasure having both of you here. Thank you so much for doing the work and for sharing some of your time with us today. Really appreciate it.
Thank you for having us.
Thank you. Yeah, I told y'all we had a whole show. It was all connected, and these are the connections. So this is how we're doing it, and this is, that's how we try to do things on the Lurie Daniel Favors Show. We need work. We need work to get done.